And then when the person started speaking, it is 4 o'clock, and I'll call this board meeting to order. Let's all stand and do the Pledge of Allegiance.
Mute yourself.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, 1.2, adopt the agenda. Are there any corrections that need to be made to the agenda as posted?
None that I'm aware of.
And if not, all right. And if not, is there a motion?
I'll make a motion to accept the agenda as presented.
I'll second the motion.
It's been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
Aye.
and I also approve. Motion carries. The agenda is adopted as posted. Item 2, the consent agenda. 2.1, consideration of approval of warrants and payroll for Northern Humboldt Charter School. 2.2, consideration of approval of warrants and payroll for Northern United Siskiyou Charter School. 2.3, consideration of approval of minutes for the September 11th, October 8th, and October 27th board meetings. 2.4, consideration of resignations, hires, leaves, and change of assignments. Are there any additions or corrections to be made to the consent agenda?
I did not see any.
I didn't see any. I do have a question though. Are the Sherry, are the resignations in there? Are they COVID related?
No.
Okay.
Anything else? Okay, is there a motion to adopt the consent agenda?
I'll make a motion to adopt the consent agenda as posted.
I'll second.
All right, it's been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
Aye.
I also approve. Consent agenda approved. Moving on to item 3, public comments on items not on the agenda. Under this item, the public is invited to address the board regarding items that are not on today's agenda. Please keep your comments concise, brief, and limited to 3 minutes. The board is not allowed under the law to take action on any matters that are not on the agenda. Should comments from the public pertain to a charge or complaint against an employee of Northern United Humboldt Charter School or Northern United Siskiyou Charter School, the board encourages the speaker to utilize the school's written complaint procedures to pursue the matter. The public will have an opportunity to comment on all agenda items as those are heard today. Is there anybody that'd like to speak?
I would like to speak.
Okay,
Hi there, my
all right.
name,
So,
can you hear me?
Yes.
yes, go ahead.
Hi, my name is Sarah Ganis, and I am a parent of 3 students at the Willow Creek Learning Center. And I am just here to make a comment about the letters that parents sent, with the hope to try to get the board to add the minutes, or make a motion to add to the next agenda to potentially vote to reopen the Learning Center as per the safety guidelines that were outlined. And due to the fact that we're so isolated and such a small learning center, we're just trying to get the board to consider reopening sooner than the second semester.
Sarah, I think,
Thank you,
I think this
Sarah.
is actually, oh, go ahead,
that-
Jerry,
that-
sorry.
Sarah, this is the first action item that we're going to take up this afternoon. So it's an item that's already on the agenda. So this particular section is for items that are not on today's agenda that somebody would like to raise.
Got
So I
it.
just want to point that out. It's,
I was just trying to let you know
go ahead.
why I was here for the meeting, just to represent the parents, I suppose, from the Creekside Arts and Education nonprofit organization.
Okay, here momentarily, Sarah, you'll have an opportunity to say all that again as we hear the particular action item 4.1. Okay,
Great, thank you.
certainly. Are there any other comments on non-agenda items that people would like to address? All right. So moving on to item 4, action items to be considered. So we start off with 4.1, approval of the reopening of Northern United Charter School facilities. I'll let Sherry take it away. For the fellow board members, for the benefit of the public who are zooming in, I venture to say that my fellow board members have read a lot of letters, a lot of the survey results, and other information pertaining to this item, as well as the overall reopening plan. And I know that there are quite a few people that would like to speak, and I just ask for everyone's patience as we go around, and you get recognized. You'll have your opportunity to have your say, and we'll just take it from there. So Sherry.
Thank you, Jerry. So there's a lot of background information in this particular agenda item. And I'm sure you guys have all gone over it. So I'll just summarize some of the items in there. So I included the results of the survey that was sent to both employees and parents. And as requested by the board, we broke it down by whole school as well as individual learning centers for staff and parents. So that's included in there, as well as the comments. In addition to the survey results, just kind of some background information from thoughts and topics of conversation that have happened with staff. I included that in there as well. You saw that there was kind of like a list of pros or advantages and disadvantages and things to consider when thinking about reopening the facilities. I also included in the background information some recommended reopening criteria. And I do have some kind of suggested amendments to that right now that we can go through in just a minute. And then finally, the last thing that I included as background information on this item is a recommendation for moving into the next phase of reopening. Currently, as you know, we're in phase 2, which is home-based independent study, with having some face-to-face for students who need additional support through IEP services. And I'm recommending that we move to the next phase, which is phase 3, and that's establishing learning hubs of very small groups of students who need additional support as well. So there's staff on right now that can give specific examples, but I've fairly recently talked to Julie about Eureka Learning Center, and she has approximately 10 students or so that really are needing some support, some seniors. I know one in particular is a senior that's really kind of starting to drop the ball, not somebody who normally receives special education services, but someone who's just not doing very well right now. And she would like to be able to have that student, as well as, like I say, a few others, come on to the facility to be able to have some face-to-face instruction, and not all necessarily at the same time, broken down by grade levels or the courses that they need support in. And those who are on campus, if they're not being supported by the same teacher at the same time, they would be in different rooms. So very little contact and easy to control. And I think one of the positives of doing this, in addition to getting the students some additional support, is allowing the staff to practice some of the things that they will have to do once we move to the next phase, where we have cohorts on campus. For example, you guys remember in the reopening plan that we ask a series of screening questions to every student, every staff member. We do it right now for ourselves, for staff members, but right now we haven't had a lot of practice of doing that with students because there haven't been a lot of students on campus. So this would give an opportunity for us to practice things like that, the cleaning protocols that we'll need to, working out bugs with bathroom usage and cleaning between usage and things like that, with very small numbers of students before we have like a larger cohort come on campus. So that was that recommendation that I've included in the packet as well. Just to kind of give a little bit of background for anyone who's on here who isn't aware of this, but at the August 13 board meeting, the board adopted our reopening plan, which for both schools, which included keeping the facilities closed for the fall semester. Second semester starts February 1st. So in the meantime, we've been allowing special ed students who receive special ed services on campus. And I think that's probably about it, other than, like I said, when, I know everybody wants to have a chance to speak, and I think we should do that. But when the board feels like you've heard from, a lot of different people, and you're ready for me to go into kind of my recommendations a little more in detail, I can, or I could do that now. It's up to you, whichever you prefer. But like I mentioned, I have amended slightly the criteria, the reopening criteria that was in your packet. I've kind of have some suggestions and some thoughts that I'd like some input on whenever you're ready to hear that. But I don't know if you want to hear from others first or not.
What's everybody's, what's the board's pleasure? How would you like to proceed?
I think,
Rosemary? Or Bianca? Go ahead. Go ahead, Bianca.
I think that perhaps if Sherry were to speak first, that it may answer some of the other folks, some of our parents' questions ahead of time, right? Just a thought.
It's a very good thought. Yes.
Okay, Sherry, go ahead and proceed.
Okay, in that case, I'm about to share my screen. So let me do that. So this, let me make this larger for me. This is kind of some amendments to the draft reopening criteria. So in looking through this, you guys know we've had some discussions recently, or I've given you some feedback recently about the fact that we've had spikes both in Humboldt and Siskiyou, and in particular Siskiyou. Siskiyou now has been moved back up a tier to moderate as opposed to minimal, where we had been and where Humboldt continues to be. And then, as I've mentioned to you guys as well in an update, we have had members of our community test positive for COVID, and that's both students and adults in both Humboldt and Siskiyou. And that has happened in the last 2 weeks or so as the rates have continued to increase in both counties. So in going through some of that and looking at our criteria, it kind of made me think that maybe we should change some things that what I had in the recommendation. So we'll start at the beginning. So you guys remember that what it said in the background information is county positivity rate and new cases, 3% or lower in the prior 7-day period, and the average number of daily cases over the last 14-day period remains below 5. Well, when you go to the Humboldt County and Siskiyou County Public Health Departments websites to see that data, they actually report it a little differently. So they don't say in the last 14-day period, they say the last 7-day period. So to me, it makes sense to have our criteria align with what the county public health departments are reporting, because then anybody can see the data without having to, go back and look at the previous week before that and then average the numbers. It seems like it makes more sense to have the data completely match so that it's very easy to compare. So what the public health departments are doing is they're calling it the adjusted case rate. And what that is they take the average number of daily cases over the previous 7 days, and they remove any positive cases that happened in a jail or something else. I don't remember what the other thing is. And then they adjust it per 100,000, population of 100,000. So when you look at the Humboldt County and Siskiyou County Public Health Departments websites, you see the adjusted case rate. So I just went ahead and put what it is for Humboldt and Siskiyou right now. The Humboldt positivity rate currently is 1%. The Siskiyou positivity rate is currently 8%. So if we had already approved this reopening criteria, you would see Siskiyou doesn't make it just because of this very first indicator, because we have to have a positivity rate of 3% or lower. And Siskiyou right now is 8%. And like I said, the county health department, I had put in this the average number of daily cases over a 14-day period, but that's difficult to find on the health department's websites. But when you do go back and average it, I found that Humboldt was 5.4 and Siskiyou was 7. So both counties do not meet that criteria because they had to be below 5 if that were the criteria. What I'm recommending is we change that last part, the average number of daily cases over the last 14-day period, to instead be the adjusted case rate, because like I said, you can find that data easily. But regardless, keeping the positivity rate, Siskiyou would not meet it if we adopted this criteria right now. The second one, county is at an overall community risk level of minimal, which is tier 4, or moderate of tier 3 for 4 consecutive weeks. Humboldt is currently meeting that. Siskiyou is as well, though they did just move from minimal to moderate. But if you guys approve this criteria as is, both counties would meet this particular item as of right now. But again, this is all draft, so this is just a suggestion at this point. The third one, county testing is available within 24 hours of request for appointment, and turnaround for results is 24 to 48 hours for symptomatic or exposed and asymptomatic testing. This is what I had proposed. In looking at the way the data is reported on the Humboldt County Public Health Department, they're reporting it in increments of 24 to 72 hours, not 24 to 48. So I would recommend if we keep this criteria, we make it align with the Humboldt County Public Health Department. But with that said, I cannot find that metric reported out for Siskiyou at all. The Public Health Department does not report it. And the other areas that I've gone to look, like the state's health department information, they don't report it as well. So I don't know if we want to keep this metric, the turnaround time for testing. I don't know how we would know if we were making it for Siskiyou if we can't find the data. And then the next one, 70% of the schools within the county are doing a hybrid approach or have open facilities. In Humboldt, as of November 10th, 53 of the 95 schools are doing an in-person or hybrid instructional model. This is 56%. I know of 2 schools that have approved opening facilities in a cohort fashion on January 19th. So I know, if everything stays the same, that will increase to 63% on January 19th. But of course, many things could happen between now and January 19th. Siskiyou, as of November 10th, 24 of the 29 schools are doing in-person or hybrid instructional model. That's 83%. And that is something I wrote previous, but since then, that's actually decreased to 72% through the end of Thanksgiving vacation. 3 schools have announced because of positive COVID tests that they're having to close, and they've decided to stay closed through Thanksgiving. So we'll see if that changes. But I want to talk a little bit about this metric, why I included this in the reopening criteria. You guys might remember that one of the things that in our discussions about liability that was brought up is the idea of, if you're doing what most schools are doing, or a reasonable person in the same situation would be doing, if you're doing that same thing, then you have less risk of being held liable, or if anybody could file a suit. But if they did, if you were doing the same thing that others were doing, that would be deemed as reasonable. So that's why I said 70% of the schools being opened, because if 70% of the schools are opened, then it's a reasonable thing that we maybe would too, where if we were the only ones that opened and no one else was open, that would not seem reasonable to the average person. So again, as of right now, if we adopted this criteria, Humboldt would not meet this particular item. But again, this criteria is draft and can be changed. This is one of the things that I was, hoping that we could discuss tonight, that I'd like input on. Number 5, 70% of staff feel the amount of PPE and protective equipment to ensure the safety of staff and students is sufficient. This is data taken from the survey that we distributed to employees. Of the respondents, 83 of them in Humboldt said 83% of them felt they had sufficient PPE. Of the respondents in Siskiyou, 59% feel that the PPE is sufficient. So again, Siskiyou would not make that metric if we had adopted it. Number 6, 100% of staff must complete COVID-19 training. This is actually something that's mandated. All of our employees have to complete COVID-19 training before we can open our facilities. As of right now, 87.7% in Humboldt have completed it. and 52.2% in Siskiyou have completed it. But I want to point out very strongly that Siskiyou was just recently assigned it. They weren't assigned it at the same time Humboldt was. So this is no reflection on them not doing it yet. They just haven't had as long yet for all of the employees to do it. But this is something that we will get to 100%. And then the final one, centers must submit a center-specific reopening plan. So as of right now, no centers have submitted that, though I know many have been working on it. Many have been working on it since last school year. I've had meetings with all of the learning centers and given a template for, in order for them to complete their reopening plan. And as you can imagine, as time has changed, even those who have started on it, it's had to be amended many times. But none of them have finalized them. None of them have submitted them to me yet, but that is something that I put as a reopening criteria. Then that's everything for the reopening criteria. And so really, in terms of the things that I had in the back, these items that I had in the background sheets, the only suggested changes that I would like to make are changing the first one to going with the positivity rate and the adjusted case rate, as the county public health departments do. That's for number one. And number three, maybe just eliminating that metric since we can't find it for Siskiyou. I don't know how we would ever know if they met that or not. So those are my recommended changes to what I had included, but I'm open to hearing other metrics or other thoughts on these metrics. And I'll stop sharing and we can talk about this now if you'd like. There's a couple other things still that I'd like to go through, not related to the reopening criteria, but so I don't know if you want to talk about the reopening criteria now.
I have a question about the reopen criteria.
Sherry,
if I
there's,
may.
Go ahead, Bianca.
The adjusted, just to be clear, the adjusted case rate, you said that they adjust it for prison, jail and prison populations?
That's just kind of an aside. They take out the positive cases
Right.
that are not in the general public. But really what's being adjusted is so that you can kind of compare apples to apples across the state. They're adjusting it for your population. So it's per 100,000. That's the adjustment that they're making.
Okay. Of non-incarcerated people, essentially.
Correct. Yes.
Okay. Okay. And so it's interesting to me because if a guard who is a citizen were to come in contact with an incarcerated person, they go into the general public.
Yeah.
Just an interesting fact that I did not know. Thank you.
Yeah. I have no idea why the state would choose to do it that way, but I'm guessing because if you're in a town that has a very big prison and they get a huge spike, that would maybe really skew the numbers. You know, you would immediately go into tier 1 when maybe it's really, the rest of the population, it's not as much of an issue. That's my guess.
Yeah, it's a good guess. Okay, thank you.
So any suggestions from board members on the reopening criteria or thoughts?
No, what you've gone through with the amendments, is fine, but why don't you go through, the rest of the plan, because I'm certain that our audience is anxious to have their say.
Okay, so I'm going to share my screen one last time. Well, I don't know if it'll be one last time, but I'm going to share it again. I'm going to scroll down a little bit so you can see. These were just some additional reopening thoughts. So one of the things that a lot of local schools are doing, and we've kind of discussed this before, is the idea that before students come onto campus, they're having families fill out an assumption of risk form, which is different than a release of liability. So I've put a link here to an example that a lot of schools are using. And essentially it's a letter that goes to parents that talks about COVID-19, the spread of it, the fact that sending your child to school at this time when COVID-19 is happening is a risk. And the parent signs that they understand that there is an assumption of risk to sending students back to school at this time. In addition to this, to the letter and the signature, then there's a second page that has screening questions that the parent asks or answers, I'm sorry. And so part of what this says up here is you agree to notify the school immediately if your child is attending optional in-person instruction, and the answer to any of the screening questions changes for your child or anyone in the child's household. So basically it's this assumption of risk form that I would recommend that when we do open facilities, we have families complete. So that was one thing I wanted to show you. And then the other thing I wanted to talk about was we've had a lot of discussions with staff about the idea of after long school breaks. So after Thanksgiving break, after winter break, after President's break, after spring break, because there's high chance that people will be traveling during those breaks or having relatives from out of town come here after those breaks. We've discussed internally the idea of having our facilities closed for a week or 2 weeks, perhaps, after each of those breaks. So that's something else that I wanted to present to you. Both of these are kind of all of these things that we're talking about. I'll be putting on the December agenda as action items, but this is just more additional information that I wanted you to know about since sending out the board packet. So that's something else that was discussed. And then another possibility of things that we have been discussing and may or may not be brought to you as a recommendation in December is reopening the facilities on January 19th rather than February 1st. This would give time for any positive cases from the winter break to show themselves. This would also give 2 additional weeks of open facilities prior to spring semester, with a total of 4 weeks of open facilities prior to President's Week. So in other words, if we wait till February 1st, as is the current plan for reopening the facilities, there won't be very many weeks before President's Week. There'll only be 2 weeks of in-person instruction before President's Week happens. And then if in fact we do decide to have facilities closed for 2 weeks after a week-long break, then when students come back, that would allow for a total of 4 weeks between President's Week and spring semester. So it just gives some additional time for in-person instruction if we open January 19th rather than February 1st. Again, it would be dependent on if the board does vote on reopening criteria. It would be dependent on both the counties, both the schools meeting the criteria at the time, but it's just some additional topics of conversation we've been having here internally. Okay, stop sharing my screen. Rosemary's hands up.
One question that I have about the additional downtime, so to speak, between the 1 week and the 2 week breaks. During that 1 week of downtime, will the students be receiving Zoom lessons?
Yeah, it would go back to like basically what it's like now, the home-based independent study.
Okay.
Any other questions from the board? No? Okay, well then let's open it up for our audience questions or comments. So I've seen Mary's hand up.
So I'm curious, I've kind of brought up the idea that for those students that are in the most critical need to be able to, although they are not students that have IEPs, to be able to still meet with them in person. For example, I have a few high school students that if they're at home, they're babysitting their younger siblings, and they're really, their schoolwork is suffering, and to be able to meet with them in the classroom at the CRC even once a week could really improve to just give them a quiet place to get work done, even, to meet them one-on-one. So I don't know if this is addressing that or not. So I didn't know where it would be proper for me to bring it up, Sherry and board. I wasn't sure where to bring that up, but I'd like to entertain the idea that for those students that teachers find are struggling, would there be a way to make that caveat that before we open, we're able to at least meet with those students to encourage their success? I don't know if this is the right time to bring that up, but that's my.
I think this is the perfect time to bring that
Okay,
up,
good,
Mary
because
Ann.
I really, okay, I didn't know.
I think you might have come in just maybe a smidge late, because that's what
Yeah,
I
I did.
started with.
Sorry.
And so that's okay. I started with that was the recommendation, was to move into the next phase where we allow students who are needing intervention to come onto campus, small numbers of students.
Great.
And
I'm
so
sorry.
that's part of the recommation. And so
Great.
when the board takes any action on this item, they may or may not include that.
Good. Okay, thank you so much for that. I wasn't sure. I was in a different training teaching students about fire in the local community. But yeah, if I could just second that and say it's important to us teachers. We're really hoping that we can meet with students that don't particularly have IEPs.
Thank you, Mary. Anyone else out there that
Judy Nelson has her hand up.
Okay.
Yes, I
Judy?
do. Hi, how are you guys? I hope you are doing well. So I'm calling specifically in regard to the Willow Creek Learning Center, and I, as well as many other parents, I believe, have written in letters or emails to the board. And Sherry, I know you said that you responded to me after I sent you my letter saying that it would be in the board packet, but I did not see it or any of the other letters in there. So I'm hoping that the board has received those letters and had a chance to peruse them before the meeting here.
Yes, the board received all letters.
Okay. And I guess, I think that there are many parents at the Willow Creek Learning Center that are not satisfied with the current situation. And our learning center, I feel, is, unique in that we are such a small, tight community. And I feel that basing what we can do on the greater Humboldt County numbers is maybe doing us a disservice, right? We don't have any active cases in Willow Creek right now. In fact, the number has actually gone down, like they've attributed numbers that were attributed to Willow Creek elsewhere, apparently, over the past several weeks, because we went from 12 to 9 when I looked at the numbers this morning. I know that there are many kids who do not have IEPs that are not doing well in this situation. And I think, speaking to, like, when you were talking about the person who was sort of dropping the ball, it's like, well, should we really wait till that happens, when I do believe that with the reopening plan, as you guys approved it, the risk is extremely low. The teachers have sent you a letter saying that they're comfortable giving in-person instruction. I think that there's an easy way to deal with, potential for travel over those breaks of just having the parents certify whether or not that's happened. And if it has, they then need to stay home for some period of time. Again, we're a small community. People are accountable to each other in this community. And it's very difficult to not be doing what works for our particular situation, because maybe it wouldn't work for some of the other learning centers. And then in the meantime, our kids are suffering from it when I'm not sure that that there is protection in a real way that is actually happening by keeping them out of school, because a lot of people have already formed pods. They're already seeing each other. They're already in contact with each other. And again, we do not have active cases here. And I feel like by waiting, we're potentially missing this window of greater safety that we have right now. You get into January and all projections say that likely numbers will go up. And so instead, we're sitting here waiting and missing this opportunity to have the kids in person learning. And then maybe we get into January and we've missed it, and then they've missed that. And I hope you guys are realizing that our particular situation is potentially different from some of the other ones. And I guess, one other thing that I did want to say is that, apparently there is like some funding issues that have changed with the, withholding or deferring of payments from the state. And I'm just curious, as far as like measures that have to be taken now that are additional of the screening and additional cleaning and that sort of thing, and what kind of avenues for grants and things like that you guys have been able to find or research for that. Because it seems that a regular public school district has gotten hundreds and hundreds of thousands of dollars of CARES money, and yet the charter schools seem to be left out of that, which I am still fully confident that we can manage all of this with our parents and staff that is there. So that's what I have to say. And I do understand it's a very challenging situation, but I would just really encourage you guys to look at our particular situation when making a decision about allowing us to have in-person learning.
Well, thank you, Judy.
Is it okay if I?
Thank you.
I don't know if it's-
Certainly, Julie, go ahead.
Is this the time
Go ahead, Julie.
to speak, or should I wait? Okay. So I am a true proponent for having the small pods return, as Sherry spoke earlier, especially for the students who are really struggling. I think that that's a really wonderful way to begin to walk into this situation. And one of the things that Sherry brought up that I think is not different from center to center, no matter where we are, is that we all need practice in regards to the safety measures. We all need practice in regards to what's it going to look like with the sanitation stations, and what's it going to look like with going through all of the questionnaires that we need to ask every morning with the students, making sure, taking temperatures before they come into class. All of these things are things that we are talking about in theory, but we have not practiced them except for as staff on one another. So the thought of bringing back students, a large group of students before all of this has been practiced, I don't think is wisdom. I think wisdom would say that bringing in small pods and beginning to work with small pods and practicing all of our protocols, safety protocols, is a very smart first step in getting students back to school full time. So that's kind of what I wanted to say. That's about it.
Thank you, Julie. Thank you, Julie.
You're welcome. Thank you.
Anyone else? Okay, we can go back to Mary.
I just wanted to respond to Judy. I'm sure that Sherry will too, but our school did get grant money to cover some of the COVID protocols and stuff. So I'm sure that Sherry could speak to that more, but that kind of has been addressed, Judy. And hi, by the way, Judy.
Okay, so who else would like to speak to us about reopening? Sarah? Okay, now's your time.
Thank you.
Go ahead, Sarah.
I just wanted to say that I really agree with what Julie is saying in regards to practice and to be able to understand what the protocol looks like. And just to reiterate what Judy was saying, that we do have a very motivated community here who would be, I know, very excited and more than willing to practice or come to some sort of training or be involved in the process in any way we can to help facilitate the reopening as soon as possible. And as Judy was saying, that we are such a small, tight-knit community, but we do have a lot of people who are really struggling with their internet connectivity, which also really kind of makes it that much more challenging for some of our families. And so, yeah, I just wanted to say that I appreciate what Julie was saying, and that there's definitely a lot of people who would love to participate in some type of practice if possible. And I think
Thank you, Sarah. Go ahead if you
I
have
was
more
just
to add.
a lot of the recommendations that Sherry were saying seemed reasonable to me. If there is some sort of release of liability form and some understandings and questionnaire for parents, that seems like a reasonable way to cover the bases, in my opinion. And now I'm done. Thank you.
Thank you, Sarah. Kurt?
I'm curious. Yeah, thank you. I'm curious, what are other schools in the Willow Creek area doing right now?
Klamath Trinity is still closed. Kirk.
Yeah,
Can I speak to that as well? Because actually, but Burnt Ranch Elementary, which is a school that, you know, many kids in our community go to, is open and has been since August 17th with no negative impact.
Is that in Trinity County or Humboldt County?
It is technically in Trinity County, but we are a border, you know, it is our community. Those people go to the same places, shop at the same grocery stores, you know, yes, it is in Trinity County. However, the kids that are going to that school are a part of our community.
Okay, anybody else out there that would like to speak up? Okay, so hopefully my connection isn't so poor that I'm too terribly garbled. But obviously this is quite complex and complicated. No matter what, resumption of school activities cannot be business as usual. The dynamics are so very different. Also, so very out of our control. And Sherry and I have had multiple conversations over the past several months about this. And one of the things she and I talked about long before it became a popular term in the news coverage was the talk about an inflection point. The fact that the coming Thanksgiving and holiday vacations being around the country, a huge inflection point is of tremendous concern. And so Sherry and I had talked about the vacations that are on the horizon and how potentially risky those events could be. You know, there's, you know, if we look at, we, at least board members in the packet and anybody that looked at the information in the packet, the pros and cons for various things. So an immediate return to in-person instruction is going to take, it's going to be some lag time. It's going to take a while for everybody to get used to the quote new normal. And as Julie had said, you know, there's going to be a lot of practice that needs to occur so everybody is comfortable. Early on, one of the things that the board had discussed was wanting to avoid starting up, shutting down, starting up, shutting down. Nobody has a crystal ball. And I admit that, you know, that what may or may not happen over the, certainly the first break, the Thanksgiving week off. But I have my own little personal story to tell. My son and his family live in West Texas. I have 3 grandsons. Friday before last, I found out that my youngest, who is 10, and the oldest, who is 18, tested positive. For the youngest one's case, apparently his computer teacher the day before tested positive. And all the children that she came in contact with tested positive, went home, and then gave it to other family members. So my oldest grandson got it from his youngest brother. Tremendous symptoms, but nonetheless, contrary to a certain segment of our population who feels that young children don't get it, are not carriers, and so forth, I have my own personal experience that indicates that that's not the case. So the point of it is that just out of the blue, unknown to everyone, something could happen. So, we have to be very cautious, judicious in every step that we take, making sure that we have all the pieces together and in place, which includes not automatically expecting teachers to step in and do cleaning in between. That's not their job. That's not their job. So I think the information that's provided in the background material in the board packet really covers the pros and cons and thinking of all the potential possibilities. And hopefully we've all taken this very, very seriously, and we don't take whatever decision now or next month or whenever, lightly. It's we need to be the most informed that we possibly can. So
Jerry, I'm just going to throw in here because it was just posted 29 new positive cases in Humboldt today and 28 new cases today in Siskiyou.
And California reached the, just as Texas did, that high number of positive cases. So it's out there. It's definitely out there. At any rate, so Sherry, let me turn it back to you.
Well, I mean, the bottom line of what I was hoping for today, my recommendation is twofold. One is asking the board to consider moving to the next phase of reopening, which is, doing small intervention groups. So what I'm referring to as phase 3. Now, with that said, the other thing that I would like the board to consider is a reopening criteria. Moving to phase 3 would only happen if we passed the reopening criteria and we were within that. With the uptick in cases today, we may not be, that's something that we'll have to see. But if we can approve the reopening criteria and approve moving to the next phase of reopening, that phase 3, seeing small intervention groups, I think that, kind of puts us one step closer to hopefully where we'll be going. And then, the other thought is, if you don't feel comfortable making this decision right now, we still have December that this can be on the agenda. Either of these items, either having the cohort, having moving to phase 3, or the reopening criteria, that can be moved to December as well, whatever you feel comfortable doing. But that was our recommendation for this meeting.
So my fellow board members, what say you?
I'll talk. I would support moving
Good.
to phase 3, and along with the reopening criteria sooner rather than later. I support everything that Julie was saying, and I think it boils down to cautious baby steps, but moving forward.
Thank you.
I would second that.
Bianca, what are your thoughts? Or, oh, thank you, Jeff. Thank you.
Well, first of all, I'd like to make a statement. You know, after reading, and then I have some questions. After reading all of the responses from families and from teachers, you know, I feel like I feel it's necessary to remind all the families, not just the folks who are here today, but for anybody who watches this in the future, that we, the board, don't just represent the students, but we represent the teachers and the staff as well. And so I read some comments that suggested that teachers are immune. And I was flabbergasted, right? Because some of our teachers are actually in the more risky, right? The more risky area of age. And so I don't know. It was disheartening to read that from some of our family members. I know that we look at teachers as though they're superheroes, for sure, especially right now. As I'm a parent, so as a parent who's trying to teach 2 children, I get it. I totally get it. It's extremely stressful in so many ways, and all of our situations are unique. Whether you are unemployed and you're dealing with that stress, but yet you're home, or whether you're trying to work and teach at the same time. So I get why, especially right now, we have this great admiration for teachers, but they are still human. They're not actually superheroes, even though we oftentimes think of them as. And this doesn't take away any of my applaud to teachers, but I feel like it's really necessary for me to make that statement that we represent not only the families and students and their families, but also all the staff and their families as well. So now that I've done that, I'm going to get off my soapbox, and I have a question for the teachers. When we talk about moving into this next phase and bringing in these small groups, how did you define it? You know, folks, students who don't have IEPs but are struggling. Are you, at least the teachers that are here, are y'all ready to make that decision? You know, there's the couple of cases that were just given. In my opinion, it's obvious that yes, bring those students in. Let's get that one-on-one action so that we can bring them back up to the level or even surpassing the level that they were at before. But we're hearing from a lot of parents that they want their children to be in that one-on-one scenario or in the small group scenario, the face-to-face scenario. So are you prepared to tell parents no, that they don't meet that criteria to come in? Are we going to set a criteria for those students to be able to come in those small groups? Which to me does seem like the best possible scenario to move forward at this time. But again, that's a lot of pressure to be able to say no to a parent who may come to you crying because they are financially struggling or they're emotionally distraught or whatever the case may be. You know, how do we help make that decision as the board for y'all? Or maybe, again, you know, I know this is a long-winded question. Are you ready for that?
I'll speak as a teacher. I'm not sure I'm clear on what you're asking the teachers about the no or the yes. Can you help me understand what you're asking us to say no to or yes to? I'm confused.
Yeah, so what I'm hearing is that we want to bring in for phase 3 students who are struggling, who don't have IEPs. How do we define that? Are you going to are the individual teachers going to define that? should we as the board create expectations? Or are you going to hear from individual families that they believe that their student is struggling to a point where they need to come in? And then are you prepared to say no to those families who don't meet either your criteria or not?
I can only speak to my students in particular, and I teach kindergarten through 12th grade independent study. But I think that it would be up to the teacher and the parents to identify that. And then I would speak with Sherry, which would be the most logical next step, and say, you know, Sherry, or unless she just wants to trust my judgment, but there are some students that I can only sit on Zoom so many hours a day with my students. I've already set up the classroom at the center, for example, where you've had your board meetings. I have all the protocols in place. I've got my thermometer in place. I've got all my cleaning stuff in place. It's already there. I've used it when I've had to give out at the beginning of the year to give out supplies and stuff. But if I have a student who's struggling, it's more about, it's not about sitting next to them. It's more about giving them a quiet space to work in. They need that and they're not getting that. And I am perfectly willing to maintain my physical distance and allow them a space to work. And even, so that I could meet a student maybe for an hour or two, but in person, so I can stand up at the board and explain something to them and have them kind of understand it. And I don't think that it's a criteria that the board could create. I think it's very individually it's an individual basis. If I've got a student struggling with, for me, more than anything, myself as a teacher, and I can only speak for me in particular, but I do believe that I speak for other teachers because they keep texting me right now, that there are just those students that even if I can meet with a student, for 1 hour a week, just to be in the same room with them, socially distanced, I think is the difference between success and failure for some of my students. And I don't think that it's a criteria based. I think it's talking with the parent and coming up with a plan. And I just have identified that need. And that's why I'm here to say that I feel that need, that is irregardless of meeting in a classroom with all the other students. There are just some students that just need tier 2 intervention, and I'm not able to give that to them over Zoom.
Right. Okay. I definitely, I appreciate that, Mary. And so that definitely clarifies a lot of things to me. So then, and I know you're only speaking for yourself, and I appreciate this dialogue. So then you'll have conversations with parents, and you're okay with letting them know that their student, even though they think that they need intervention, you're okay with letting them know that they don't actually need that intervention because they seem to be on track based on your professional assessment?
I'm saying the exact opposite. I feel
Okay.
like I'm the one who is asking to be able to provide intervention for my students. I'm not trying to tell parents, no, I can't provide this intervention. I want to be able to offer this intervention for my students, because I have high school students. I have 16 high school students, and some are struggling. And I know that if they could just be in a quiet space where they could focus, for many different reasons that I won't get into each personal student, but even for 1 hour a week, to be able to provide that learning environment for them so that they could have focus, have discussion, have conversation. I think, so I'm not saying that that parents are asking for it and I'm going to deny the parents. I'm saying that I'm asking for it and want to offer it to my students and parents. So I'm saying the exact opposite. I feel there's a need and I want to offer that solution.
So Bianca,
I'll jump in.
I think that maybe you're asking, well, what about all these kids? I mean, maybe I'm wrong, but there's all these kids. But along with Mary Ann, I think for me, I'm going to be using a lot of the surveys that we actually took. And I'm going to be looking specifically at the students and the parents on those surveys And then I, in my own mind, know the students who are struggling. And I can tell you, I've already vetted all that out. And the parents that are in my case, I can only speak to my case, but the parents who are really screaming, I feel like I'm doing something weird with my microphone.
It sounds weird.
But anyway, the parents that need it are the parents that said it. And then when I went and looked at the students and their grades and what's going on in their Zoom classes, what's going on in their Apex work, it's the exact same kids. So, you know, overall, I mean, maybe not every single case, but overall.
Yeah.
So in my case, it's going to be the same with Mary Ann, is that I'm going to be reaching out to the specific students. I can tell you that I am of that age group that is of concern. I'm also of the health group that's of concern because I have an underlying issue. However, I am willing and I want to do this. And I specifically want to do this with small groups to begin with, as I've said, because I do think that in theory, it all sounds great that we have these questions and we have these thermometers and we have this and we have that. We have not practiced that. And the only way to get perfect or the only way to get good at it is to practice. And the best way to do it is on a small group of kids so that when we do have a real reopening, we are absolutely ready and we have worked out all the bugs, because there are going to be bugs. And I can tell you one right off the bat. We'll be really great with those questions for the first week, and then we'll forget to do it, or we'll think, oh, they look okay or whatever. That's not okay. We need to follow this stuff religiously. And so I'm just saying that in my case, I feel really good about the small groups, but I really do feel that it's super important to practice all of this before we start letting in a bunch of kids. So that's my say so.
And I'll go back and reiterate what
We
Julie's
have a couple
saying.
other hands up, Mary
Okay,
Ann.
never mind.
And,
Sorry,
yeah,
I can't see the hands up. Sorry,
Yeah.
sorry. But even if
I think
need to
Rebecca
go back
Zespin was
one,
next.
Yeah, okay.
I was just going to say that I feel like for some of my students and some of my parents, if they hear that I'm letting some kids come back to school and not others, there might be a lot of uproar. But I also want to say that I feel confident in the support that I have from staff and from Rebecca, that I would be able to tell those families that we can't open for everybody. And it's only for those kids that really need it. So I feel for at least our center, we are supported enough to be able to tell families that they qualify or don't qualify. And that's all I have to say.
Rebecca Davis, your hand's up.
Yeah, so I was going to answer Bianca's question about criteria. And so in our last staff meeting that we had at the end of October for CLC, we discussed our criteria, and one would be if they had a missed assignment meeting. And so the district policy, the missed assignment meeting, if they have had one of those, then they would qualify to come on site. And then the other criteria is if they fall into tier 2 based on our STAR data. So if they're in the red or the yellow, they would be tier 2. And so that's how we created our criteria. And I just looked back at our staff notes, and we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So we have 12 students who currently fall into that criteria at our center. And then just one other thing I wanted to address that was a concern from our staff is with the elementary kids, if we allow these learning pods, but then we have a week break and then we have another week, and they get to come on site for 2 weeks and then they're off for a month. There's so much breaking. It's like there's so much learning loss that is it really beneficial to be on site versus off site just for the elementary kids. I just wanted to bring that up. And your other question is, are parents going to find it inequitable or unfair? Yes, because I have many more parents and students that would like to be on site that don't fall into that criteria. So for sure, tough conversations will have to happen. That's all I have to say.
Rita, your hand's up.
I want to say that I really appreciate the connection to these pods being tied to intervention. And I think we've had time since school has started to really identify these students who need this intervention. And we're trying, as teachers, we're trying the best we can to help them from afar, making phone calls to their parents, helping out, emails, extra Zoom meetings, whatever we need to. But really for the students' best interest, having them come to the Learning Center might be exactly what they need for their best interest. And so in all of our education, it's about the students and what's best for them. And we can do our best to have safety measures in place and do what the guidelines say. But we could do all of that and still get sick no matter what. So I think we can't overlook the need that the students have. So that's it.
Bianca, I'm going to follow up on your question. And yeah, teachers will have to make that judgment call. It does have to be on a case-by-case basis because we're dealing with humans and each individual has their unique, experience. And so there's no way to make just a straightforward criteria, though it sounds like Rebecca at Cut Learning Center has attempted to do that. I would also add students who are having, and this may kind of align more in some of what Julie and Marianne were talking about, but I would also add students who are having some social emotional issues as needing intervention as well, not just the assessment data from our STAR 360 assessments, but also, our teachers know who these students are. They have to make these kinds of judgment calls all the time. And we have to remember that equity isn't the same as equality, and we don't treat everybody the exact same way. We don't treat everybody equally. We treat everybody with equity. People get what they need. Students qualify for free or reduced lunch and others don't, but everybody would like to have a free lunch, but it's what your student needs to be able to access their education. And so these are the kinds of judgment calls that teachers have to make all the time and are very good at doing. Teachers know their students and their families and the situations at home. I would like to argue, and I know I'm very biased, but I would like to think that our teachers know that better than teachers at a lot of traditional site-based schools, because we deal with the families all the time. We have family meetings. We go into the families' homes. And so I think that this is something that our teachers are very good at doing.
Thank you. Thank you. That puts a lot, I appreciate all of y'all's comments and suggestions and knowing how you're ready to take this on already. You've already put a lot of thought into it, sounds like. So I appreciate that. And it helps me form an opinion for us to move forward. And I hope that in no way any of this came off as me not thinking that you're prepared, but rather I'm looking out for your best interest. And I need to know that. And the only way I'm going to know that is by asking the question. So I appreciate the dialogue very, very much. And so I guess aside from, what my fellow board members have to say, I'm wondering, Sherry, if it makes sense, can we workshop during this meeting? Can we workshop that criteria to be able to vote on it? Because there are definitely, I have some opinions on some of it. Some of it I agree with 100%, and then there's a couple things that are still a little cloudy
Sure,
for me.
I was hoping for that. I would really like some feedback on it.
Okay.
Hey, Jerry, I'd like to just have a comment.
Go ahead, Jeff.
I just want the people that are tuning in and those who will hear this message, how hard this is at this point in time to absorb all this. And I want everybody to know that all the information that was provided by Sherry, I've read every single letter. I've read multiple times. I've read the parents' responses, the teachers' responses, Sherry's comments, even Jerry. And it's complicated, to say the least. But I want you to know that there's kind of this trust level that's going on. You guys hopefully will trust us as much as we trust you, because you guys are in the trenches. And so seeing all that, and we all have the students' best interests at heart, that the decision that we make, regardless of what it is hopefully the best decision for everybody, which may not be true, but Sherry kind of hit it, equity and equality. And I think that I guess I just want you to know that I've taken this thing so serious that I've spent countless hours just going over this information and statistics and looking at things. And I wish I knew you each individually better. And hopefully that will come in the future. But for now, it's just kind of making that decision with what we have to work with at this point in time.
Thank you, Jeff. Thank you. So Sherry, why don't you start the workshop aspect of the criteria?
Would it be helpful for me to share my screen again and show that criteria? Okay, let me do that.
Sure.
The bad thing about sharing the screen is we don't get to see each other's faces as well, but just know that I have a big smile on my face. Okay, so here's the first one. Let's just take them one at a time. And remember, any of them can be amended, any of them can be thrown out, any of them could have additions. In my opinion, probably this first one is the most complicated. So there are actually two separate data points that this first one is addressing. It's addressing the county positivity rate. And the way that I wrote it originally, it also addressed the average number of daily cases over the last 14 days. So two different data points, positivity rate and average number of daily cases over a 14-day period. I'm suggesting that we change this to county positivity rate, keep that data point, but the other one, adjusted case rate. And the only reason I'm saying that is because that is how both county public health departments are reporting data. So it's a very concrete, objective piece of data that anybody can go and look up on the public health website. But if you try to look up average number of daily cases over the last 14-day period, you actually have to do some math. You have to look, you have to find the last 14 days number of cases, then you have to average them. Not that that can't be done, it's just not as easy or readily available as that adjusted case rate. So any ideas, thoughts, suggestions from the board on this particular item?
Just my comment, I agree with you, Sherry, that, the way you've kind of expanded it and taken in consideration, I guess a bigger or better scope in my mind. I think that would be a better way to read it and understand it.
Rosemary has her hand up. Rosemary, it might be hard to see the hands raised right now with the screen shared. So
You want these things, huh?
mm-hmm.
Okay. I agree with both your direction and Jeff's comment we're not the only ones that are going to be reading this. And so we want it to flow and be easy for everybody across the board to look at reopening info #1 and be able to read it without scratching their heads.
I agree as well.
Okay. Bianca, did you have any comments on that #1, or should I move on to #2?
No, I think we should move on to #2.
Okay. So #2, I wasn't suggesting any changes to this as it was previously presented, and it's just that the county is at an overall community risk level of minimal, which is tier 4, or moderate, which is tier 3, for 4 consecutive weeks. Maybe that's too long. Maybe it should be less than 4 weeks. You know, that's totally at your discretion. Maybe it shouldn't be minimal or moderate. Maybe it should just be minimal, the lowest level. Again, this is completely up for discussion. One just little piece I will add is you have to be, okay, if in the county, if your data starts heading south, in other words, your positivity rate increases, your adjusted case rate increases, that has to happen for 2 consecutive weeks before you get moved to a different tier. So I just wanted to put that out there so that you knew what the state and the county health departments were using in terms of when a county moves from one tier to another. Their data has to be in that, hit those benchmarks for 2 consecutive weeks.
Sherry, you talked about the minimal tier or tier 4. Prior to today, I believe there were only 6 counties in the state that were on that particular level. Is Siskiyou one of those 6 counties?
If it was, it's not anymore. Now it's moderate.
Okay. Yeah.
I would just be in agreement the way it is now. I mean, I'm not sure, you know, you're kind of tit for tat. I mean, you got to go with some kind of a statistic or number. And, you know, I think it's a fairly good indication, you know, being a short term and long term, I think.
I mean, thinking about the purpose of this, if the community risk is high or higher, you know, meaning there's more positive cases in the community, how long would we feel comfortable waiting for that risk to go down prior to opening the facility? So if, let's say, we were in the high group, high tier, or let's say we were in tier 2, not the highest, but the second to highest, and we moved into the moderate tier, how long would we want to be in the moderate tier before we would say, okay, let's open the facilities? That's kind of another way of looking at this particular criteria.
Well, as you said, Sherry, the county would have to be in the moderate tier, ready for 2 weeks to be placed into the moderate tier. So really, if we were to stay with this, we're talking about double the time.
You're right. I totally agree.
So in my opinion, I mean, I think that we should take it down from 4. If we took it down from 4 to 2, then that would mean that we were technically in the minimal or moderate tier for actually 4 weeks.
Correct.
Because
I
of the
agree.
state guidelines.
Mm-hmm.
And that would clear us. What do you know what the move in the opposite direction is? I don't know what that is.
Same.
Okay.
So that to move from a tier, whether it be up or down, you have to be hitting that next tier's benchmarks for 2 weeks.
Okay. Okay.
And see, 2 weeks is consistent with a quarantine period, 14 days.
Mhm.
I just think it's a good tool. So,
Okay. Okay, I'll move to number 3, unless it's jump out board if there's something else you want to say on that one. But number 3, county testing is available within 24 hours of request for appointment, and turnaround for results is 24 to 48 hours for symptomatic or exposed and asymptomatic testing. Now, this is the one where I said the way that Humboldt County Public Health reports this piece of data is in a 24 to 72 hour ban. So if we left it the way I have it written now, we would never meet that metric because they don't report it out that way. Siskiyou, I can't find the data at all. So shy of contacting county public health in Siskiyou every time I want to know what that number is, it's not going to be a metric that the public would be able to find either. So, you know, I totally feel like testing availability is an important key to whether, you know, how the community is doing and whether or not our facilities should be open. But I'm just not sure what to use as a metric for that if we can't find the data.
Mm-hmm.
So though I'm not on the board, Sherry, I do get tested every 2 weeks and I have the entire time. And we've just barely reached where I get my results in 72 hours. We're not still getting results in 48. So that would be, just as a bystander, my suggestion would be.
Right. And there's lots of anecdotal stories from lots of people getting the results back sooner or later, but we have to use a concrete piece of data that we're getting from the same location every time. And so that's why I was using the Humboldt County Public Health Department's metric for that.
I'd recommend that we go with the county's 72-hour metric.
I would
And
agree
thoughts
with
for
that.
Siskiyou?
Why?
Yeah, it's in absence of anything from Siskiyou, then just stick with the 72 hours in Humboldt for both counties.
So, but Jerry, maybe I'm not very clear, which is very likely. It's not, with Siskiyou, I wouldn't ever be able to know if they met that target because Siskiyou is not reporting their turnaround time.
Mm-hmm.
Could you put something to be determined, case specific, something in there that is kind of sort of vague, but yet we have something there for Siskiyou that it is semi-accurate. We don't know, but to put 72 hours, like you said, we don't know.
I mean, if I think I'm an advocate for taking this out altogether. I know from experience that Siskiyou County is testing same day and at longest 24 hours. And again, it's all anecdotal. Those are my experience of friends and my own family needed to go and get tested. And they are reporting that if it's positive, it'll come back at 3 days, but if it's negative, it could be a week. But again, all anecdotal. So if we're saying that in order to reopen, that the county needs to do this, I mean, I think we need to look at the fact that we are rural. Both counties are rural counties. The resources of many of our public departments are not that of larger populated with higher tax income counties, right? Where they are able to do this type of testing and report it out quickly. So I'd advocate for taking this out altogether. Otherwise, I think that it's going to hinder us from being able to open, especially if there is a spike after these holidays and the number of people who are trying to get tested is higher, and now their wait times go back simply due to understaffing. I just think that this is going to hinder us greatly from being able to make progress. And I'm not sure that it's, you know, if some, yeah, I'm not sure what it would do to keep us safe, because if
Right.
somebody has symptoms, then we have protocols in place to shut down, or, you know, depending on what happens, but we have those protocols in place. So I'm not quite sure how this would help us.
I would agree with you, Bianca. I mean, I think this is something that we should just blackline for now. And I think we could either come up with something better in the future, or if this doesn't help us with anything, honestly.
Okay. I will move to number 4. 70% of the schools within the county are doing a hybrid approach or have open facilities. So this is really an arbitrary number. It could be 60%, it could be 50%. It's, you know, it's whatever we feel comfortable with. And just so you know where I get the data from this, I think I shared this with you, maybe in the background sheets, or I don't remember when, but both county offices of education report this out. And all of the schools are asked to keep this updated. It's a chart that each of them keep, and we're asked to keep it updated with what we're each doing. So that's where I'm getting that data from. Again, it is arbitrary. I mean, some may feel that if the majority, so over 50% are open, then that's a reasonable thing. Some may feel like you need more than just over 50% for it to be what most people would do. So,
But and I'm with you. I don't think the number tells us anything really. I mean, we got Willow Creek asking to open up, and you know, they might be the exception to the rule, but it might be beneficial for them to open up. So I don't know that number helps a decision for me. I don't know honestly if I really care how many other schools are not, or, you know, participating, or I mean, because you're right, it could be 20%, another one 90%. So it doesn't, that number doesn't affect, you know, what I'm thinking at least about things.
Well, my understanding is that this particular aspect is for liability reasons. And I hear, you know, it's interesting because, like, I believe it was Judy who pointed out that the neighboring school, Burnt Ranch, is technically in Trinity County, but yet y'all are visiting the same stores, and, you know, that's part of the community. And so that raises a good point. Are we going to consider, because the second sentence says this will increase at least to 63% on 1/19/21, right? So then with this number, whatever it may be, are we going to consider what the other schools plan to do at the same time that we're going to open up? You know what I mean? Is that?
I think the way that I'm envisioning using these reopening criteria is, you know, checking each day these data points. And, you know, so if I check tomorrow, you know, the chart that shows how many schools are open in Humboldt County versus how many are open in Siskiyou County, and if we fall below whatever this number is, whatever we end up setting, then that means we wouldn't be able to open because of we hadn't met the criteria. So, you know, these are just data points. The only reason I included this information right now is just to let you know, if we had this in place already, would we be able to open or not based on this criteria? It's just a snapshot in time of, you know, November 10th when I checked, when I wrote this. But my plan would be to look at this data. So some of it, the stuff that is like the first couple things that I put on here, like the number 1 and the number 2, those are updated every 2 weeks. So I would check that data every 2 weeks when it's updated. It's on Tuesdays is when the state and the county health departments update that information. So every 2 weeks, I would check the data, the metrics, and see whether or not we would be able to be open, moving forward. And so I would do that same thing with this data point.
Since this is for liability, is there any indication from attorneys on what would be a good number a best number to insulate us?
They just say the standard, kind of the standard is what most, they use the word most, or a reasonable person. So, I mean, there's no concrete number. It's really just what our comfort level is. Like a safety in numbers kind of thing.
Mm-hmm. I keep thinking of 60% just because there's my background, 2/3 majority. But this is completely different. So I don't know if the board has
that's
suggestions.
That's as reasonable of a suggestion as any, I think. Okay, I'll just I'll make a note here of 60. I'm just making these comments so we can go back to it if and when there's a motion. Okay, the next one, 70% of staff feel the amount of PPE and protective equipment to ensure the safety of staff and students is sufficient. This is the current data. This is something, I would need to be able to say that we're hitting this target. Every time I review this metric, I'll need to issue a new survey, every 2 weeks or whatever we decide, to see if people are still feeling comfortable. Because what you guys saw in the comments, a lot of people commented on, right now there's plenty of PPE, but we don't have students here right now. Once we have students here, we're going to be going through it a lot quicker. Will we be able to keep up with the demand? So how staff feels about this may change over time. Is this a metric we want on here? Is the 70% sufficient? Should we, is there, what are your thoughts on this one? This, and I have to say, the purpose of having this on here is the idea that I think, I don't remember who it was that said this. Maybe it was Rebecca. I can't remember, but it's the idea that we need a sufficient number of staff members who are willing to work with students in person to be able to open our facilities. Because if we don't have enough people, we can't socially distance the kids because there won't be enough people to be with, to supervise. There has to be a sufficient number of staff members that would be willing to meet face to face. And reasonably so, people feel, people need the PPE to feel secure. And so this definitely, and staff has the option of taking a COVID leave of absence if they don't feel comfortable in meeting face to face. So that's kind of my rationale behind putting something like this on here, a kind of metric that says we have sufficient number of staff that would be willing to meet face to face. And I guess my measure of that is if they feel like they have what they need in PPE. Maybe that's an assumption.
Well, it kind of goes back to what we were talking about earlier, putting it into practice is going to be, this number is going to tip one way or the other, I think.
True.
You're not going to know until you actually do it, if it's even a good number at all.
Right.
But you want everybody to be comfortable, obviously. So I think that's something that would just, could be this now, but we could have to review it, I think fairly quickly and kind of see where that's at. So yeah. There might be a panic button that gets hit, because, it's overwhelming or whatever. But so yeah, I mean, it's something to look at, but I don't know that that number is concrete, for me, for, deciding on anything.
Mhm.
Personally, I think 70% is too low.
Mm.
Yeah, I think I can agree with that. I mean, that means a third of staff does not feel comfortable, and that's a lot of people.
Agreed. So
Yeah,
what
that
are
is a
your
lot.
thoughts?
And so, Sherry. Well, I guess we have to account for the possibility that there may be some who believe there's never enough.
Yeah.
But hopefully after all the information you've provided and talked about, and gone through all the steps, outlining all the steps we're taking to ensure the health and safety of everyone, that will be a small number. I mean, is it I don't know, is it unreasonable to say 80% or 90%? I mean, it's 70% is.
Yeah, because what we're really talking about is the comfort level, right? As well as a health level at the same time. So, honestly, I mean, it'd be nice for it to be 100%. I mean, but I don't know if that's unreasonable.
I think that's unreasonable.
Julie?
I don't think ever achieve 100% on any topic, actually.
I would agree with that. I would agree with that. And again, this is something that we don't know how people are going to feel yet. I mean, this is all, in theory, right now, 70%, 60%. I mean, obviously, I think that especially leaders in centers, principals, regional directors, if we get in and we start seeing that our staff are panicked, I would think that we would automatically, say, okay, we're closing it down or whatever until we figure out what's going on. But, I don't think that we will ever get 100%. I don't think we will ever get that number. I think 70%, 75% is a great number to begin with. And then again, once we actually get into the field and do this, I think we're going to learn a lot and see a lot because, I know most of us have asked our staff, what is it going to take to make you feel safe? And I can say beyond a shadow of a doubt, knowing that my husband is a principal in Covelo and it's a larger school than we have, that we have more PPE available to us than they have to them. I mean, our classrooms are full of PPE. Thank you, Tammy, for all the ordering that you've done. Thank you, Sherry, that grant that we have. We have more air purifiers than we're ever going to know what to do with. So I guess what I'm just saying with all these words is, I think 70 is a good number to begin with, and then we can, we can see how it shakes out.
Rita, I see your hands up. It's been up for a while.
I was going to mention that many of the staff at learning centers are small anyways. So if you have 4 staff and 3 out of 4 say it's good, 3 staff is, could do a lot with students and can be manageable. So when you're trying to come up with a number, just keep in mind that the staff is already pretty small. And so it could easily go down to 50% if you only have 2 out of 4 that are willing to meet with students, or, you know,
Right.
feel like there's enough equipment. And then the other thing I want to mention is the PPE and protective equipment that can change. Like, that's a variable measure.
Right.
And so you might be asking staff one day and it's 50%, and then here you get the shipment in, and then you have to ask again, and then it's a variable amount from day to
That's a
day.
very good point. And it makes me wonder if we should change this metric altogether and not be whether or not staff feel like there's a sufficient amount of PPE, but instead, do we have a sufficient amount of staff who are willing and able to work with students? Or the reverse, you know, do we have a very small number of staff who are requesting to work at home, continue to work at home, or go on leave?
Oh, I see what you're saying.
Like, do we have the sufficient number of staff to serve our students? Maybe that's really more what we're trying to target.
Can I say something?
Yeah.
Yeah, I was thinking that feeling that the amount of PPE is sufficient is very subjective. What one person
Yes.
feels is sufficient is totally different with somebody else. And I'm kind of trying to wrap my head around why there's only 52%, you know, or no, sorry, 59% answered positively in Siskiyou. And I'm wondering, maybe there's some people who have just been exclusively working from home and don't realize what we've purchased and what we have, you know, so.
Right.
Well, and keep in mind, that's 59% of the respondents. In Siskiyou, the number of people who responded to the survey at all was pretty small. They're only-
Even on the teacher side?
Yes, 71% of staff reported. So this is, you know, 59% of the 71% that reported. So it's, you know, it's hard to know. But you guys are all bringing out a very good point that this is a subjective metric, and that's what we want to avoid. We want objective criteria. So I think we ditch this and potentially come up with something else that is related to having a sufficient number of staff to serve students. Or not replacing it with anything. I don't know.
Yeah, but I agree with you, Sherry. I don't know that it could put us at a detriment rather than a benefit, you know, and that's, we're looking for things that will benefit us. And I don't know that this will.
Okay, well, we'll stick a pin in that one and move on. Number 6, 100% of staff must complete COVID-19 training. There's an objective measurement. That's one to know for sure, one way or the other. And this is just one of those things. Our staff has to be trained in, and the thing, just so you guys know, the things that are included in the COVID-19 training are things like what are symptoms related to COVID-19, what is considered an exposure, you know, the hand washing protocols, the face mask protocols, how to put it on, how to take it off, how to, you know, all of those kinds of things are included in that COVID-19 training. So that's a very generalized term there, but it's a specific training that we have that our employees are viewing through our Keenan Safe Schools trainings platform that we do. It's the same way that our employees receive training for things like sexual abuse mandated, sexual harassment mandated training, or abuse reporting mandated reporter training, things like that. And the training video module that we're watching is approved by like Cal OSHA and California Public Health Department as meeting the things that, you know, the staff needs to be aware of. So that one I think is pretty cut and dry, unless there's something I'm not thinking.
Well, Sherry, the other training that we're doing that's part of that too, which is a separate training, they quote unquote call it the pesticide training, but that's how to clean to keep germs free. So the cleaning aspect is a separate training. So we're actually, just so that most folks know, there's actually 2 trainings that staff are getting, one on cleaning protocols and one on COVID protocols. And I think that all staff should do it. I think they're both good trainings.
Thanks, Mary Ann.
Maybe we
And
should
then the last,
include. I
I'm
was
sorry,
gonna
go ahead,
say, maybe we
Jeff.
should just include that in it. The cleaning aspect, the other additional training.
I'm missing an I. Is it integrated pest
Management.
management?
Yep.
IIPM?
No,
Yeah,
just
it's-
IPM, integrated
Just
pest
IPM.
management.
Okay.
It seems odd, but that's where we learn what cleaning products to use safely around people and everything that will kill.
Okay, and then number 7, centers must submit a center-specific reopening plan. I mean, that again, to me seems, now this just says that they must submit. Maybe I should say they have to be approved. So submitting isn't sufficient. I have to review it and approve it.
Yes,
Submit and approved.
yeah.
That'd be yes.
Okay. So just to get us kind of back on track, I'm cognizant of the time. Do you guys feel comfortable in voting on this reopening criteria tonight? Or would you prefer that I consolidate all of our notes, get it all down into a final version based on the things we discussed and present that next month as an action item?
I would lean towards just kind of accumulating all this again and then bringing it back to as one thought. So it's not so convoluted.
And I do think that there are a couple things that maybe we didn't exactly settle on. They were kind of up for discussion still. So what I would do for those, if I did kind of distill it down into the things we talked about and summarize it and clean it up, I think for those specific things, I, would kind of point out the different things that we talked about. And then at the board meeting, we would have to hammer that stuff out in open session with public comment again.
What is the feeling for having a special board meeting just for this, once everything is all cleaned up, kind of like a second reading, so to speak?
Mm-hmm.
I would vote for that, Rosemary.
Again,
I
even
think
though sorry. I'm not
Go
on the
ahead.
board, but.
What do you think, Bianca?
Oh, sorry, Bianca, go ahead. Does this include the one-on-one students that are needing tier 2 and tier 3 intervention, or is this for school-wide opening?
That's actually another thing that needs to be discussed still.
I am fine with having a special board meeting, Rosemary. I think that it's important. But I also feel confident in all of the edits that we just made on this specifically. I understand that there are some maybe things that could be added to it, but I'm confident in what was did. But this doesn't, we're talking about like two different things, right? We're talking about, do we need this reopening to be for school-wide, or is it also for phase 3? So I think that we kind of need to break that down, Jerry.
Yeah, agreed.
Well, I think the edits that we've discussed, the only one that's outstanding is the 70% of staff. And, we talked about it, and, and it's actually, it's not 70% feel that we have enough PPE. It's actually out of the staff. Do they feel comfortable in meeting with students? So it's not the matter, although realistically PPE does factor into it, but it's really about staff members feeling comfortable to meet with their students. And so that's the only thing that's, again, to borrow a term from Bianca, that's the only thing that's still kind of wonky.
Well, I don't know that we decided if we were comfortable with 70% of the schools. Somebody suggested 60, but I don't know if we settled on that. And then I don't know that we decided number 3, were we going to take that one out altogether since there's no metric for Siskiyou?
Reasons to have the special board meeting to.
Yeah, I know. I think it almost needs to be like a study session to really nail these down.
I would agree with that.
Because we've been at this for 2 hours, and you know, we've got half of the agenda left to go through.
Do we want to look at our calendars and pick a date for that special session, special board meeting?
Sure.
And my hope would be next week, because then we get into Thanksgiving break after that. So it'd be nice to have the criteria done next week.
I'm open to that.
Mm-hmm.
Are we talking at 4 o'clock or 10 o'clock in the morning? Is
I
it,
think we can decide that,
okay,
and we can pick a day too.
I'm not available on Wednesday.
Okay.
I'm available all week, so.
I am too, and actually any day after 10:30 works for me.
Jerry?
Well, then let's shoot for next Thursday at 4 p.m.
Okay, I do have a conflict on Thursday at 4. That's like one of my only conflicts is Thursday at 4. I can meet anytime before that, or sorry, or any day before or after, or any of the other days.
Then
Well,
Tuesday.
Okay. Morning, afternoon,
4.
That works for me.
What's the date?
The 17th. And I would have enough time to get the agenda out.
I'm good for that.
Bianca, is that good for you?
Yes.
Okay. Do we want to save whether or not we move into phase 3 for that time as well, rather than talking about that now?
I think we should. Because in my opinion, it all falls under that same reopening umbrella.
I agree.
Okay. And maybe we'll decide too, then the idea of maybe having the facilities closed after breaks.
Mhm.
and whether or not this criteria applies to the intervention, kids who are needing intervention. Same with the breaks and yeah, okay,
Yes.
okay. I'm gonna stop sharing my screen.
Okay, so we've decided to continue this discussion as it pertains to criteria, breaks after vacations, and phase 3 opening.
Yes.
Is that correct?
Yes.
So should there be a motion to that effect? Since this is a action item?
I'll make a motion to have a special board meeting to continue our discussion and possible action on 4.1, the approval of reopening our facilities.
I'll second.
I think we just moved to table it, table
It's been moved
the
and
agenda
seconded.
item. Mhm.
All right.
Want me to
I mean,
rephrase
that's,
it?
I was going to ask if, so technically, Rosemary, withdraw the motion. Jeff, withdraw the second.
I withdraw the motion that I just made.
Well, actually, you can't withdraw it once there's been a second, but you can amend it.
I'd like to amend it, please. This is just like a smorgasbord here. I would like to amend the motion to move our approval plan for reopening to the special board meeting on the 17th. Doesn't Jeff have to do something now?
Yeah, he has to agree to amend his second too, to fit your motion. But I thought you were going to table it. I thought that's what you were going to do, is table it.
You said I had to take it back before I could table it.
This is very rough on a
And Jeff
first-time
had
note
to take
taker.
back his second.
Yes, I know.
Yeah,
So when
Rosemary, I
he
think you
takes
just
it back, then I can move again.
no, you don't need to take it back. You just can just say, I want to amend my motion to table the item to our special board meeting. That's it. And then Jeff could amend his second, and that's it.
I'd like to amend my motion to table item number 4.1.
Now I'll second.
Okay. So it's been moved and seconded to table 4.1. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
Aye.
carries. 4.1 is tabled. 4.2, certification of unaudited actuals for Northern United Siskiyou Charter School.
So you have this in your packet. This is, we did this for Humboldt already. And you guys remember that these are our actual revenues and expenditures for last fiscal year, 1920. They have not been audited yet. So once these actuals are audited, they may change ever so slightly. The auditor may find some things that need to be moved around a little bit, maybe some minor revisions. But I'm recommending that you approve the unaudited actuals for Siskiyou Charter School.
I'll make a motion to approve the unaudited actuals for NU Siskiyou.
I second the motion.
It has been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
Aye.
and I also approve. Motion carries. 4.3, Resolution S 2021-1, resolution for Siskiyou County Office of Education to transfer funds within NUSCS account.
So you guys know, because we contract with Siskiyou County Office of Ed to complete the budgets for Northern United Siskiyou, the board must give permission for Siskiyou County Office of Education to transfer funds within the account. The resolution allows Siskiyou County to make those necessary reconciliations within our account that they found were needed while doing the unaudited actuals.
Any questions or comments? Is there a motion?
I'll make a motion to approve resolution S 2021-1 to allow the Siskiyou County Office of Education to transfer funds to NUSCS.
I'll second that.
It's been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
Aye.
and I also approve. Motion carries. 4.4, approval of memorandum of understanding, MOU, between Northern United Humboldt Charter School
Are you waiting for me to talk? I think I'm getting delays.
Somebody gonna say something?
Yeah, I think that I'm getting delays, like only, I don't know, lots of time is passing. I don't know if that's for everybody or not, but so, okay, it's for everybody. It's not just me. Okay. You guys probably all who are on here know, because you've seen this before, but Northern United Humboldt Charter School and Northern United Siskiyou Charter School share the same federal tax ID number. And we have employees who work for both entities. So what the county office suggested is that we have, for those employees that are shared employees for both schools, that their payroll runs through only one of the county offices, so that their W-2s would be accurate. because both the two different entities, Siskiyou County Office of Ed and Humboldt County Office of Ed, couldn't both produce a W-2 for the same employee with the same federal tax ID number. So that's why we have all of the payroll for those employees who are working for both schools go through Humboldt County Office of Ed. And then what we do is Northern United Humboldt Charter School invoices Northern United Siskiyou Charter School for their portion of the employees' salaries and benefits. And we do this there's an MOU that lays out the terms of this agreement. And an invoice, like I said, is sent from Humboldt to Siskiyou. This year, we are proposing it slightly differently than we have the last 2 years. And that is, in the last 2 years, we proposed the terms of the MOU was Siskiyou reimbursed Humboldt one time at the end of the school year. This time, we're proposing that Siskiyou reimburse Humboldt twice during the year. So the first half, halfway through the year, and the second half at the end of the year. And the reason we're doing that this time is because of the cash shortage in Humboldt. So Humboldt doesn't have the resources to front that for the entire year for Siskiyou. So that's why invoicing twice rather than once this year. That's the only difference.
Thank you, Sherry. Are there any questions or comments? Is there a motion?
I'll make a motion to approve the memorandum of understanding between NU Humboldt and NU Siskiyou.
I second the motion.
All right, it's been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
Aye.
and I also approve. Motion carries. 4.5, approval of MOU between Northern United Humboldt Charter School and Humboldt County Office of Education, HCOE, for Career and Technical Education, CTE teacher.
Okay, this, I'm not sure if you've seen this MOU before or not. I don't know if you saw it last year or not, but what happens is Humboldt County Office of Education has somebody that they employ. She is a teacher who has the necessary credential to teach health career pathway courses. And what that is on the high school level, students can take courses in what's determined to be a pathway, which means they are, it's kind of like an emphasis in a particular area. And there are quite a few of these areas that the state has deemed as pathways, and it's for career and technical education. And on the Humboldt side, the pathway that we offer is health careers. And so it's a series of courses that are focused on having a career in the health field. And to be able to teach these types of courses, these special CTE pathways, you have to have a particular credential. It's not a credential that anyone within our school holds themselves. And so Humboldt County Office of Education has an employee that does hold this credential. And they allow the schools in the area that have this pathway to utilize that teacher. And so we basically all split her salary and benefits based on the proportion in which we use her. So let's say we use her 0.2, 20% of a full-time salary. That's how much we pay, 20% of a position. And there are about 3 different schools that utilize her. And so this MOU spells out the terms related to that HCOE will hire her and, do run their payroll through her. They'll make sure, she's meeting all the requirements necessary, and will pay our portion when they invoice us.
Thank you, Sherry. Any questions or comments?
I have none.
Is there a motion?
I'd move that we take action on 4.5 approval of MOU between Northern Cal, NUCS and Humboldt County Office of Education, HCOE, for career and technical education CTE teacher.
I'll second that.
All right, it's been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye. Aye.
Rosemary,
Aye.
Jeff,
Aye.
We can hear crickets.
and I also approve. Motion carried. 4.6, approval of independent study policy.
This is just an item that we have every year where boards are required to review and update, if needed, the independent study policy of the school. So this is just an annual item. I have no additions or updates to it. So unless you guys had anything, it's just an approval as is.
Thank you, Sherry. Are there any questions or comments? No? Is there a motion?
I'll make a motion to approve the independent study policy.
I'll second that.
It's been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
Aye.
I also approve. Motion carries. 4.7, approval of the single plan for student achievement, SPSA, for Northern United Siskiyou Charter School.
Okay, I think
Sherry?
we've discussed this before. You haven't seen a SPSA before because the federal government has allowed schools in the state of California to let their LCAP stand in place of their SPSA. But this year, the state of California waived the LCAP because of COVID. But the federal government did not waive the requirement to still do a plan. So that's why you're seeing the SPSA this year, but you won't see it again probably because we'll go back to the LCAP. But just so you know what the SPSA is it's the plan that says what the actions and services we're going to provide to students who are high risk or that qualify for Title I. And it addresses how we're going to spend our Title I federal funds. That's why the federal government cares about this particular plan, is because it addresses federal funding, where the LCAP addresses state funding with a small portion where we talk about federal funding. But since we didn't do that this year, that's why the federal government wants us to do this SPSA. And one other thing is the school site council is one of their responsibilities is to review school plans like the SPSA or like the LCAP. So from now on, you'll be seeing plans like this go to them first. and they approved it. And then with their approval is their recommendation to you for you to approve it. So it's already gone to school site council. And, you know, this is basically they recommend that you adopt this plan.
Thank you, Sherry. Any questions or comments? Yeah. Is there a
I'll make a motion to approve the single plan for student achievement, SIPSA, for NUCS.
A second.
It's been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
Aye.
and I also approve. Motion carries. 4.8, approval of the reassignment of a SISCU director to a Humboldt director seat of the Northern United Charter School Board of Directors. Sherry.
Oh boy. Okay. Is anybody else really tired of talking? I am. So as you guys know, in our bylaws, it said that if we were unable to find somebody to fill the seat of a board member that we, in a particular county, we could fill the seat with a board member with somebody from the other county. So that happened when we had a vacancy come up in Siskiyou, and many months went by without being able to fill that seat. We finally found somebody to fill that seat, but that person lived in Humboldt. And so we went at the board, according to the bylaws, went ahead and appointed a Humboldt person into a Siskiyou seat. Now, due to circumstances, a Humboldt seat has become vacant again. And so I'm recommending that we shift the Humboldt person that's in the Siskiyou seat to the Humboldt seat, so that we again have an opening for a Siskiyou person. We again have a Siskiyou seat opening, so that we could attempt to fill it with a Siskiyou person. Did that make sense at all?
Does it feel weird to be talked about but not talked about?
Yeah. Yes, Jeff. So I'm hoping that we can have Jeff fill the vacant Humboldt seat, because then, you know, we could fill a seat with a Siskiyou person, so we can get back to what the bylaws and what we all want, which is kind of the equal representation.
So a while back, Sherry and I had a discussion about this, and I pointed out that while we made allowances for the fact that if a seat went unfilled for an exceptionally long time, that if there were two candidates from the same county that came forward, that we could accept both of them and therefore have a full board. But we never really specified a procedure in the bylaws to rectify that should circumstances change. And so under the current circumstances that have come upon us, and also because coming soon, two individuals' terms are going to expire, that we wanted to approach it in this manner. And so until we have an official amendment to the bylaws that takes care of this. This is the next best thing. So hopefully it's understandable, reasonable, and okay with Jeff.
And just to give you a little more insight too, our thought was if Jeff switched into that Humboldt seat now at this board meeting, well, next month, December, is when Bianca's seat term ends. And that's when the currently vacant Humboldt seat term ends. So next month, if both of those board members are willing to serve again, next month they could be reappointed to new terms. So as both of their seats were expiring in December, they'd be appointed to a new term and a brand new term starting.
Gotcha. Clear as
Does
mud.
that all make sense? Clear as mud. Clear as mud. Okay, so is there a motion?
I'll make a motion to approve the reassignment of a Siskiyou director to a Humboldt director seat on the NUCS Board of Directors.
I'll second that.
It's been moved and seconded. All those in favor signify by saying aye. Bianca,
Aye.
Rosemary,
Aye.
Jeff,
You're muted, Jeff. There you go.
There you go. It's weird to vote for myself. Aye.
and I also approve. Motion carries. Good. So moving on to 5, reports.
So
Sherry?
5.1 enrollment and attendance report the report is in your packet. I'm sorry, you guys, this is funny, just the delay. The report is in your packet. And you can see, as usual, it's kind of a month behind because we don't have all the attendance completed at the time this packet goes out. So this enrollment and attendance is as of September 25th. At that time, Humboldt had 409 students enrolled. Siskiyou had 159 students enrolled. And at that same time, September 25th, Humboldt's attendance rate was 95.29 and Siskiyou's was 97.23.
Any questions or comments?
No.
Okay. 5.2, financial report for Northern United Humboldt Charter School and Northern United Siskiyou Charter School. Tammy?
Hi. Can you hear me?
Yes.
Okay.
Yes.
This is just the financials for October, our payroll and all our AP. And that's about it. It's our monthly normal. Any questions?
And then, well, I was going to say, and you guys got that graph that Tammy, that we forwarded you that, at first it was kind of, some of you had a hard time seeing the chart on there, but she thought that would be a good idea to show you every month, to compare what our expenditures are each month in comparison to the same month in the previous fiscal year, as well as in comparison to what we budgeted for this year.
Any questions or comments? No? Okay, let's move on to talk some more, Sherry.
Okay, just a little bit, I promise. I just wanted to talk about two things. One is just a quick loan update. So you guys remember I talked about applying for a loan with the California State Finance Authority. So I went ahead and filled out that application and submitted it for both Humboldt and Siskiyou. And just as a reminder, there's no commitment at this point. It's just an application, and more information will come as we get closer. In about February, sometime probably around February is when we would expect to get more details on that, and where at some point you guys will have to actually take action on it. You'll have to vote to approve if we want to take it out, but like I said, it won't be till about February. In the meantime, I attended a webinar put on by the Charter School Capital organization, and it's actually, it's unlike the California State Finance Authority, which is a governmental agency. Charter School Capital is not, it's a business. But one of the things they do is give loans to charter schools. So I attended a webinar that they put on and had a preliminary meeting with them. And I anticipate they're putting together a loan offer, and I anticipate meeting with them next week to go over it. But the reason why I'm looking at other options, not just that California State Finance Authority that we applied for. I may have told you this already, I'm not sure, but you remember that the amount that we can get approved through the California State Finance Authority is the lesser between either your deferred amount or how much you spent on facilities last fiscal year. Well, in Humboldt, the amount we spent in facilities last fiscal year is only about $279,000 or something like that. But we're going to have a cash shortfall of about 200, or maybe our facility costs were 276, and our cash shortfall is going to be 279. So we're not even going to be able to borrow through the California State Finance Authority the amount that we're projected to have as a cash shortfall. So in other words, it's not enough. And so looking at Charter School Capital for the Humboldt side, we may do them instead of California State Finance Authority because they will lend more. So they would lend enough to cover us. There are some downsides to it. There's definitely going to be some pros and cons. And this, I anticipate we maybe will have a special board meeting just to talk about this when we get a little closer down the road toward this. But the California State Finance Authority, their interest rate, they don't know it yet. You know, they won't know until we get closer and we lock in. But they're estimating anywhere between 1.5 and 3%. That's the one that's the governmental agency where it's not quite enough for Humboldt. Charter School Capital, they're estimating right now would be about 6%. So significantly higher interest rate. So that's the con. Some of the pros are, one is they look at it and operate it very much like a line of credit. So you only take what you need as you need it, where the other California State Finance Authority, it's one lump sum at one time, which means you start paying interest on the entire thing right off the bat. But the Charter School Capital one, because it works as a line of, kind of like a line of credit, you're only paying interest on what you're borrowing at the time. So there's that to consider. Another thing to consider with the Charter School Capital is their loan. Okay, let me try to explain this. We're going to have the deferrals from the state in February, March, April, May, and June. So they're going to give us 5 months of deferrals. They pay us back the next fiscal year. Starting in July, you get repaid back for June. In August, you get paid back for May. So it's kind of a reverse payback. The state's going to give us the deferral they owe us from the most recent month first, then the further away. What Charter School Capital, that part of their program is that very first deferral we get in February, they don't charge us any interest for that. And why that's a bonus is because that's the last repayment we get. So July, August, September, October, November, we won't get paid back from the state for February of this year till November of next year. So the fact that they're not charging interest, Charter School Capital isn't charging interest on any money you take for the month of February, is also a little bit of a pro. So, you know, again, nothing is set in stone at this point. I'm just gathering information. But those are, you know, that's just kind of where we are right now. And I will continue to update you every meeting. The last thing on this topic is today, the state released the application that schools can complete to ask for an exemption from getting the deferrals. So schools can apply to the state and say, hey, can we be exempted from the deferrals? And we've been told it's a long shot, but it's worth applying for. You have to show that the deferrals would keep you from meeting your financial obligations. So in Siskiyou, it's not really an option. We never go in the hole in Siskiyou. We're able to meet our financial obligations. Humboldt, that's not the case. We go into the hole in May. We cannot meet our financial obligations starting in May if we don't have a loan. So today we went ahead and filled out that application. It's not due till December 15th, I think, but we completed it today because they say if more people apply than they have money for, then it's going to be a first come, first served basis. So we finished it today and we submitted it to Humboldt County Office of Education because that's the requirement. They have to review it and certify that the data that we put in it is accurate. We have to submit a cash flow projection along with it, which Humboldt County Office of Ed is the one that prepared the cash flow projection. So we used their data. So I don't think they'll have a problem certifying that it's accurate. But anyway, so we submitted it today. They let us know, Humboldt County Office of Ed let us know that they are going to review it and that also they reached out to CDE today to get some more details. And we expect to meet with them next week. So I just wanted to let you know about that. You know, I just figured it's worth a try and we'll see what happens with that. And so that's it for kind of the loan or the financial kind of update. The last thing I wanted to tell you about is we had a facility on the Humboldt side. We had a facility committee meeting, our first facility committee meeting to discuss the fact that both Eureka Learning Center and Cutton Learning Center's leases will end at the end of next school year. And what we want to do to either, you know, find a new location or exactly how we want to handle that. So we developed kind of a timeline, kind of a backward timeline of when we would need to have another place. And in the process of these conversations, we have been talking a lot about changing the instructional model, in particular of Cutton Learning Center. So right now it's set up in a way that looks very much like a traditional school, site-based school model where kids attend all day long, Monday through Thursday. And so we've been talking about the idea of potentially changing that so that it looks a little more independent study, students not being there all day, 4 days a week. And kind of the sustainability of having it in the way that it currently is. And knowing that if that instructional model changed somewhat, our facility needs would be different. We wouldn't need the same number of classrooms in a building that we currently do because of the way our instructional model is set up. So we talked about, you know, thinking about the instructional model, the fact that when and if, I guess, we do open our facilities into kind of a cohort model this spring, that would be a good kind of test run for what it could look like if the instructional model was changed from a 4-day-a-week to like maybe a 2-day-a-week program or something like that with cohorts. So that's part of the discussion because it impacts what our facility needs are. And so that's just a small little summary of what happened at that meeting, but we have another meeting scheduled, and so we'll keep you updated as we move forward on that. And that's it for my report, unless you have any questions.
Are there any questions or comments for Sherry? No?
Oh, well,
Go
go
ahead.
ahead, Rosemary.
Oh, that was it. That was it. Just good job throughout this whole meeting, Sherry.
Thank you, Rosemary.
Yeah, and I just wanted to say thanks for looking into a another loan possibility.
Mhm.
Okay. 5.4, Northern United Humboldt Charter School Report. It had been submitted part of our packet. Doesn't look like Julie is still with us.
Rebecca's here. I think she's the one that did the report.
Oh, excuse me. Sorry, Rebecca. You want to
That's
have?
okay. It's okay.
Do you have anything additional that you want to tell us?
No. We tried to step up our board report this month, Jerry.
Colored pictures. Colored pictures.
It looks good.
It does.
Mhm.
It looks really good.
Yes, thank you. And I love the details about Henrietta.
Yes.
Okay, 5.5, Northern United Siskiyou Charter School. Kurt,
Yeah,
anything you want to highlight or?
no, not really. I mean, I was grasping at straws kind of for finding things to put in this month's board report. So I figured I'd just give you some details about those field trips that you saw the photos for last time, what they were actually learning.
Good.
And then I talked a little bit about the site council, but Sherry, explained what that was all about too. So
Okay, good. Well, thank you. 5.6, board report. Let's start with Bianca. Do you have anything to share with us?
I really enjoyed the YLC, the welcome back video. I appreciate you sending that along.
we're
Other
working
than
on one
that-
for Mount Shasta too.
Oh, awesome. Awesome. Other than that, no, I don't have anything to report. Thank you, Jerry.
Rosemary?
I don't really have anything to report, but what I would like to say is a big thank you to our visitors, the staff, and fellow board members for such a heartfelt conversation on a topic that I think everyone is very passionate about, which was our reopening.
Thank you. Thank you. Jeff?
And likewise, I felt all those letters that I read, both from, the parents and the staff and the teachers. I just try to put myself in their position and I get it. I used to be a school teacher at one time. I used to be a student at one time. So I certainly get it. And I'm not a great learner via, Zooming. So I get it. I mean, firsthand. So yeah, and thank you for the people that took the time to write those heartfelt letters and express in their hearts, to us, the board. So, and Kurt, the welcome back video, I thought was outstanding. It was a great tool for me to get to know some of those people. I mean, I still getting to know faces. And so it's a cool thing for me to go, oh, okay. So I know who that is and put a face to the name. So yeah, thank you so much I know it wasn't easy to do. So thank you for your creativity and your technical expertise. And then a final thanks, not final per se, but Sherry, thank you. These are some murky waters that we're kind of going through. Man, I mean, I don't even know how you sleep at night. I mean, the stuff that must just swirl around. But thank you so much for being the director you are, and for just, taking care of us and looking at options, to make things better for everybody. So yeah, heartfelt thank you for me.
I
Yeah.
second that.
Well, we definitely make a good team. Team approach, there's strength in numbers. And, what we've gone through tonight or this afternoon, now it's night, a lot of time and effort by a lot of different folks have gone into that product. And so lots of consultations and seeking out other kinds of information. It's definitely a team effort. So moving on to discussion item 6.1, discussion of the telework policy. So this is the first reading. Sherry?
Yeah, so really, I just want to say, hopefully you've had a chance to look at it and you saw my rationale for putting it in there, because of COVID, really so many more people are working at home than ever before. And so it seemed kind of pertinent that we have a teleworking policy. This was something that was developed by Young, Minnie and Core, our legal firm. I just put it in here for any feedback anybody may have, any suggestions, ideas, thoughts. And then, of course, next month it would be on for a second reading as an action item. So if you've seen anything that you want to tell me about now, you can, or if you want to tell me sometime between now and next month, please let me know.
I have a question.
Okay.
What are the current guidelines for the folks that are working at home? Are they following this guideline, or have they been?
Some and not all. Some of the things in here, they have been and some have not. Like, for example, I think it says something in here to be able to work at home. You have to get like approval from me or something like that. It might even say written approval. I can't remember for sure. I know we debated about whether or not we kept written in there or not. But, for some people, they did get permission from me like recently. Other people have continued working at home from when I gave them permission at the end of last year. So that would be an example of where some people are, did it one way and some people are doing it another way. But these are the kinds of things that kind of brought it to our attention that, okay, we need a clear policy now, because there are people who are working at home that is very easy for their job to be done at home. And in some ways it helps the school for them to be done, for them to work at home, because it lessens the number of people that are in our office, for example. So therefore lessens the number of people we have exposure to or things like that, and they can completely do their job at home. There are other people that can't do their job as well at home, not because of who they are or their abilities or whatever, but because of their job, whatever it is their job entails. For example, custodial, can't do that from home. That has to be done at the facility. So we really just felt like we needed to kind of spell out some of these guidelines. And my thought is, because this policy was not in place, things that are in here now couldn't necessarily currently be enforced. But once the policy is in place, what will happen is it will be distributed to all employees with, the idea that, or, with the instruction that, anyone who wants to continue working at home needs to follow these guidelines, starting with asking, for permission to do so, and, all of those kinds of things.
I also have a second question. It has to do with the information regarding confidentiality.
Oh, yeah.
There's a line down there about taking student records. Is that something that the auditor would approve, that student records are being taken home rather than kept in a secure location?
Yeah, as long as there's a policy in place, then the auditor would approve it if we're following our policy. And the idea of if they are taken home, they have to be secure just as they are in a facility.
Okay. Thank you.
Mhm.
Any other questions or comments? Okay, moving on to 6.2, discussion of reappointment of board members to the Northern United Charter School Board of Directors. Sherry?
So this is just a continuation of what we were speaking about earlier. I guess, somewhat formally wanted to make sure that Bianca and Jeff were both on board for continuing in a new term starting in December, assuming that the board appoints you to those positions again. But I plan on putting that on the agenda. So if, I'm not going to call you out right now, but if you do not want to continue, just let me know. You could just shoot me an email or call me or something later. But I think I already have a pretty good feeling that, in fact, you do want to continue.
I won't let the cat out of the bag. Yes, I would like to continue.
Any good. Any comments, questions?
Would it be a 3-year term or a 2-year term? Or do we draw straws again?
No, we don't draw straws again. Now it's 3 always. Now that we're on the staggered, the whole point of that 2-year was so that people would be staggered that first go around. But now that that staggering has been established, all terms will always be 3 years.
Cool.
See, this is another one of those areas that is not spelled out in the bylaws. And so, again, Sherry and I have talked about this. And so at some point in the future, I think we've settled upon that we will use when counties require people to file for an open vacancy on a school board to give collectively the board an idea if you intend to continue your term or you're looking at withdrawing or resigning. Although the bylaws still state that that there's no real deadline as to when a person can resign. It's just address in what manner a resignation is supposed to be should one occur. So anyway, so there'll be no surprises for next month. Number 7, next board meeting, 7.1, possible agenda items, the telework policy, second reading, first interim budget overview for parents, the organizational meeting. Anything else, Sherry?
No, I just want to point out that the organizational meeting involves picking our meeting calendar for next year, for the 2021 calendar year. It also involves electing officers for the 2021 year. So be thinking about that.
Okay. Any other thing from a board member?
Well, the next the next meeting is the 17th, the special board meeting, not the December one. Does it make sense to go ahead and add the telework policy to the beginning of the agenda of our special board meeting? Is that enough time for the board to further review it? Seems like an important policy to get into place.
Mhm. I'm okay with that.
What do you think, Sherry?
It's fine with me. I mean, it's, until I get some feedback on it, it's ready to go. So it,
Yeah.
it doesn't really, I have plenty of time.
Mhm.
But it's not very long for you guys but maybe you already reviewed it anyway and
I have.
Mhm.
You okay with that, Rosemary?
Yes.
Okay. So excellent suggestion, Bianca. So Sherry, let's put that on first of our special board meeting. And the next regular board meeting is December 10th. And with that, I'll adjourn the meeting, and it is 7:00 p.m.
Good job, Jerry. Good job facilitating that.
Yeah,